Miss Jackson from 13 South. I need a rapid response in room 136.
In medicine, it's a total team sport. So how do we create that team functioning environment? That's the current major challenge.
In order to really help this patient, this person in the bed, we all have to work together and we have to communicate well.
Hi, I'm Dr. Cousins. We're from the Rapid Response Team. What's going on?
Miss Jones, she has a lot of breath. She has an history of COPD. On my assessment, I saw that she was tachypneic, tachycardic. She was in respiratory distress, so I call rapid response.
When you bring forward the whole notion of teamwork, you get folks together in a room and you get them really talking about it, they get it. It resonates for them because they do understand that this is the missing link. If we communicate more effectively, we really will help our patients, but you know what? We'll help ourselves work more effectively as well.
Defibrillator.
What's going on?
CPR, my defibrillator.
I don't feel well.
How are you doing, sir? My name's Dr. Wang. Your name's
I
Al?
don't feel good.
What's wrong today? What's bothering you?
My chest hurts.
Your chest hurts? How long has it been bothering you?
Like 3 or 4 days.
3 or 4 days? Okay. So why don't we start off, can you put
Is
them on
anyone
the
going to
line
help me here?
and get an EKG?
Teamwork and communication is one of the most challenging areas in the healthcare industry right now. 70% of errors in healthcare is based on communication or teamwork failures.
Okay, have you ever
So
had
simulation is a tool, one of the few tools that really allows for doctors and nurses and other healthcare personnel to improve that piece, the critical piece of communication and teamwork.
We're doing training with very lifelike computerized mannequins that really allow us to simulate emergency scenarios that clinical professionals may only see rarely during their career.
Sir, hello? Hello? Is there a pulse? No? Okay, let's start CPR.
It gives them an opportunity to go through those scenarios as a team.
Clear? Clear. Some questions, I'll check the placement. 2 minutes are up. Let's do another pulse check.
I feel a pulse.
You feel a pulse? I feel a pulse now.
Nicely done. You brought
And
them
then
back
to
as you
pick it
promised.
apart
Great
and
job.
debrief it and really appreciate how they could have performed better and how they could avoid potential medical errors and how they could better communicate and better coordinate their work in these high-stress emergency situations.
I noticed there was a shift in sort of delegation of responsibility and leadership. I think it's extremely valuable because I love what I do. Using simulation to help train doctors and nurses is a great feeling because ultimately it affects and improves patient care and quality of care.
Now, I understand that her partner does not know she's HIV positive.
Partner does not know.
We introduced the team steps and the team meeting concept some years ago here. We gather at least twice a day. We go over all the cases that are on labor and delivery, doctors, nurses, midwives, physician's assistants, pediatricians, and anesthesia there because they all may have a role in taking care of the patients.
We've informed her that we cannot inform him. All the information about the patient is divulged at that moment, and if you have any questions, you can raise them then and there, so that there's no miscommunication and that everyone's on the same page.
All right, the next case.
Ever since we put team steps into play, it's been much more organized. For the nurses, it's very empowering because basically we are the ones that run team steps. It just makes you feel confident in what you're doing so you can understand and you can convey that confidence to your patient.
Each time I get the kid, they will explain to me what they're going to be doing. They communicate very well, and they will speak to each other all the time.
There's not a morning that goes by where somebody doesn't learn something that he or she did not know before that team meeting.
She's going to deliver. She's going to deliver today.
And in the case of an emergency, you can simply call the people and say, do you remember the case we talked about today? And everybody moves in warp speed. Shoulder to shoulder. Okay, hold on.
This is Ms. Parker in the labor room. We need anesthesia staff. 4171.
4 nurses, Ms. Parker. I need 4 nurses.
Okay.
Team steps is about improving teamwork.
So we start oxygen by nasal cannula to IV inserted.
We're going to give you a little bit of oxygen and hopefully that'll make you feel better. And it's important with rapid response because a lot of those tools that you learn in team steps can be used to help the rapid response team work together more efficiently and more quickly, ultimately benefiting patient safety.
How are we doing on saturation?
The saturation is about 97%.
How are you feeling?
A little better.
Okay, good.
I know that Team Steps saves lives. I have seen it happen before, and I'm sure Team Steps works in any other service.
We're in the process of actually training everybody, from physicians to nurses to cleanup crew. Everybody has to be trained in Team Steps.
It's something that we have embraced as a systematic way for us to elevate the performance of our clinical teams. This work around coordination and better communication among teams is absolutely central to patient safety, and Team Steps is an important part of that work for us.
Since she feels much better now.
I think it's done a good job for us and our patients.
Feel better.
Teamwork and communication are the bottom line to having all of this work.
It takes a lot of focus to improve teamwork, and it takes a willingness to really appreciate that this is something incredibly important.
The nurses, the doctors, the housekeeping, they're all one. They communicate very well with each other. We are in this together. We are a team. And we're looking to accomplish even more. And we see the little stones that we've moved to move the mountain.